Are you struggling with back pain? My name is Kennedy Rongo from the physiotherapy department at the current hospital. When it comes to back pain, research tells us that in every 5 individuals, 3 of them are suffering from back pain or in their lifetime will suffer from back pain. So how do you prevent back pain? Now, it goes back to the first question that you might ask a physical therapist when you go to see them after experiencing back pain. And the question is, what causes back pain? Now, the answer to that question is so many things cause back pain, but most commonly, back pain is caused by how you interact with your environment. For example, how do you bend to pick something from the floor? How do you sit in your chair at work? How do you sit in your chair at home? How do you sleep at night? How do you drive your car? All these things might make you develop back pain. So now, let's start there. What is the right posture of sitting? You need to make sure that your desk, your chair slides inside your desk, okay? Because at all times, your back needs to be supported by the chair. So the first thing you need to make sure also is your chair has a good backrest. And then when you sit, you can easily do things at your desk with your back supported. You can easily sit like this for a very long time. But what happens if your chair is too far from your desk, you'll end up scooting forward and your back will eventually curve, and eventually you will start developing back pain. So when most of us bend to pick something, we do it in a very wrong way. And wrong posture might mean injuring that back very badly. So what are you supposed to do? Now, whenever you're picking something, you're supposed to go as closest to it as possible. And remember, your back is not as strong as you think. You need to use your legs because your legs are stronger than your back. So usually go as closest to whatever you want to pick as possible. Use your legs and not your back. So instead of bending, using your back to pick something and subjecting all this weight to your back, simply just go down using your knees, pick it up and bring it back up. That's the correct posture of lifting something. So what are some of the simple exercises that you will do to give you some relief? And that's what I'm about to show you. Okay? So one of the exercises that you can use, that you can do at home, that will not require any resource actually apart from a bed or somewhere you can lie comfortably, is this. So Mr. Caleb, I'd want you to place one hand there and the other hand on the other side. So make sure your waist does not lift off the bed, and then try and come back up. Very nice. Okay, how does that feel? Good. So I want us to do this 4 to 5 times, okay? Okay, so just go again. Very good. 2, 3. Good job. 4, and the last one. 5. Very good. Okay, then relax. Ideally, this simple exercise should give you relief in pain. But in the event that that aggravates your pain or makes it worse, please contact a physical therapist or a doctor near you. Second exercise that you can simply do at home that will go a long way into relieving the pain you have is, Mr. Caleb, I want you to try and lift this leg backwards. Just this one, just like that, and down. Okay, up and down. So I want us to do 3 on this side and then 3 on this other side. Okay, so we can start with the right. Good job. That's 1, 2, and 3 on the other side. 1, 2, and 3. Good job. And the last exercise I'll show you that I think will help you when you're having some pain is this. Please turn around. Okay, so I want you to bring your knees as closest to your chest as possible. Good, and then you can use your hand. So try and squeeze and relax. This is a really good exercise for your back because what it does is it tries to open up your spine. Again, in the event that this particular exercise worsens your pain, please stop and seek help from a qualified physical therapist. Now, remember, ultimate care means that you seek professional help. And that's where we come in. I encourage you to call the number below, book an appointment here at the current hospital, where we have a very unique model of treatment. We combine exemplary customer care, we have an array of cutting-edge technology, and we have very good expertise to help you take care of that bag. Thank you very much.
Have you ever wondered why you might be having bad breath? Well, my name is Dr. Diambo Margaret, the dental surgeon at the Karen Hospital. So bad breath, in other words, is called halitosis. It's usually caused by different factors. It might be because of poor oral hygiene practices, cavities in the mouth, gum diseases, gastric issues. So for you to have a proper diagnosis, you should make a point of visiting a dentist to be able to rule out the factors that I've mentioned. Bad breath is best prevented by diagnosis, of which, bearing in mind the factors I've mentioned, we'll be able to rule out the bad breath causes that might be in place. So if you have cavities, a dentist will be able to do fillings. If you have gum diseases, we'll be able to do cleaning of your gums and your teeth. If you have bad brushing techniques, your dentist will be in a position to teach you and help you how to brush your teeth. The following factors have been checked and you still have bad breath, your dentist will be in a position to advise you accordingly and to refer you to the appropriate physician, because as I mentioned earlier, bad breath can also be caused by gastric issues. Some of the measures that you can take to ensure that you don't have bad breath are proper brushing techniques and also use of oral sprays that can also be used to mask the bad breath. But these oral sprays and gums are usually short-term measures. Therefore, for you to know the root cause of your bad breath, you should consider paying a visit to your dentist so that you might have a long-term solution to your bad breath. To get your oral health back, welcome to the Karen Hospital Dental Clinic. You can call any of the numbers on the screen. Welcome.
My name is Mark Nyachio. I'm an occupational therapist for 13 years of experience. Currently, I head the occupational therapy department at the Karen Hospital. I'm going to talk about occupational therapy in children. Well, you will know when a child needs occupational therapy in 3 categories. If they are school going, those children who at school are not able to have very legible handwriting, their concentration is not as per the other peers, and maybe their learning ability and peer and social participation is not like the other kids. So we have categories of children with specific learning disabilities and ADHD, which is attention hyperactive disorder, and also sensory processing disorders, where we have autism spectrum disorder. So these 3 kids present with challenges in imaginative skill, social interactions, and handwriting and concentration. So those ones will require an occupational therapist. Those also who have motor and challenges in motor skills, that they are not able to walk, they are not able to do fine motor skills like holding a pencil, the grip and the grasp skills, they will require occupational therapists. We have cerebral palsy cases, which we are talking about motor skills in terms of walking, sitting, standing, and that skills. We also have children with Down syndrome who have social and interaction skills, and also have challenges in activities of daily living, with this dressing, feeding, toileting, and transfers. They require occupational therapists. At birth, we will have kids who we identify that they really need we call them high-risk kids, who require occupational therapy. Maybe a premature, those who have not reached term delivery, all those who have complicated delivery, the duration and the process, and those who are severely underweight will require what we call early intervention and monitoring occupational therapy for monitoring the developmental growth. We have what we call developmental growth and chronological growth. So maybe at 6 months, there is some skills we want the child to have. Maybe at this level, they have not got the skills. We will require an occupational therapist to fast track and facilitate this kind of skills. Also, we have a category of kids who have maybe falls and injuries, traumatic and any other falls, accidents. They will require occupational therapy to address in terms of motor skills, fine motor skills, splintage, and functioning. So basically, the role of occupational therapy is to enable these kids to be as much as possible independent in their daily life, in their schooling, and their play. The major occupation of a child is play. So any skills which interferes with their ability to play and interact with the other peers normally, it becomes an occupational therapy client. At the Karen Hospital, we will get the occupational therapy services under the Department of Physical Medicine 24 hours of every day. It is the service which integrates with the speech and language therapy, where we do sensory stimulation, motor skills training, speech facilitation, and communication and language facilitation. We also do individualized educational plans for the kids to integrate in school, so that we follow up with the specific teachers on their specific learning needs. We call them learners with additional learning needs. So the occupational therapy department at the Karen Hospital, we do see these kids, and we encourage you to visit, call the number on the screen and visit for our services, so that we do a one-on-one interaction, we assess the child, and we cooperate with other team members, so that we have an individualized educational plan and a school placement plan for these kids. As I said, schooling and play is the occupation of a child. That's why they need to see the occupational therapist, which is available in Karen Hospital, in the main hospital, and in one of our branches in the Nyeri, where we have a child development center, which is specifically integrating all these services under one roof, which requires occupational therapy, speech therapy, physiotherapy, and another pediatric services intervention.